Hi everyone. We're going to talk about something really important, nursing documentation and handover. Good notes and clear handovers aren't just paperwork, they help keep our patients safe and make teamwork smoother. There are many ways to write nursing records, but today we'll start simple, with basic narrative documentation. Let's learn how to write clearly and logically, so our notes actually help the next person understand the patient fast. Let's get started. Why do we need nursing documentation? There are 4 main reasons. To tell others about the patient's condition. If something changes, we need to write it down so the next nurse knows what happened. 2. To protect both the patient and ourselves. If there's ever a problem, the record shows what care was given. 3. To help with teamwork and handover. Good notes help others understand what's been done and what to watch for. 4. To show evidence of our care. If it's not written, it's like it didn't happen. So, documentation isn't just writing, it's a part of safe, professional nursing. Narrative documentation means we write one full paragraph each shift. Just write what you see, patient's consciousness, vital signs, any complaints, what care you gave, and how the patient responded. No special format needed, just be clear and honest. When you write a nursing note, just remember to include the basics. Is the patient awake or drowsy? What are their vital signs? Did you notice anything special or did the patient complain about something? What care did you give and how did the patient respond? Also include IV fluids, any medicine, and how much the patient ate, drank, or peed. This is an example of a simple admission note. The nurse writes when the patient came, why they came, and how they are now. It includes vital signs, oxygen use, IV and catheter, and what the nurse did. The note also shows the patient's emotion, and that the nurse gave comfort. Everything is short, clear, and easy to understand. This is a sample daily note. It tells us the patient is stable on oxygen and their vital signs are okay. The patient still has some shortness of breath and coughs yellow sputum. The nurse gave chest therapy and oral care. It also shows input and output and treatment like IV and antibiotics. Finally, it says the patient is calm, and the family was informed. This note explains that the patient had trouble breathing and became drowsy, so the doctor did intubation. The tube was placed smoothly and connected to a ventilator. It shows the ventilator settings, oxygen level, and that the patient is stable but unconscious. The nurse gave mouth care, checked the skin, and informed the family. It also shows safety steps like suction and emergency tools are ready. This note shows the patient is doing better and is ready to leave the ICU. The patient is awake, can do basic things, and is on low-flow oxygen. IV and catheter were removed, wounds are clean, and handover was given to the ward nurse. The patient and family agreed with the transfer. Everything is calm and safe. When you write notes, focus on the important points, not telling a story. Just follow this order: what you see, what you do, and how the patient responds. And remember, each shift should write at least one paragraph about the patient's care. Here are some common mistakes when writing notes. Don't forget to write what care you gave. Always write the time. Don't just write what the patient says, add what you see. And avoid unclear words like condition fair, be specific. Handover is important because it keeps care going smoothly from one shift to the next. It helps make sure nothing is missed or repeated. And it saves time. Everyone knows what's going on right away. SBAR is an easy way to give a clear handover. S, situation, means what's happening now. B, background, means what important things happened before. Assessment means what do you think is the problem. R, recommendation, means what do you suggest we do next. Here's an example of using SBAR. S, the patient had shortness of breath this morning. B, they have COPD and were on 2L oxygen yesterday. Now their oxygen dropped to 88%, even with 4L oxygen. So, we suggest the doctor checks and maybe changes the treatment. Here are some tips to make handover easier. Use short and clear sentences. Say the most important things first. Follow the SBAR order to keep it organized. And don't forget, if something is not clear, ask or explain again. In addition to new admissions, transfers, or discharges, any significant clinical changes during the shift must also be documented separately. From today, let's all start writing one clear and useful note in every shift. It's not just for the patient, it also helps you and your team give better care. Enjoyed the video? Give it a like and share it with your fellow nurses. We'll keep bringing you more useful nursing knowledge and support.